Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone. This is Christopher Cunny, and welcome back to another exciting episode of Straight Outta Health IT. I am your host, and today I have a return guest and someone that I highly admire whenever I'm trying to get my own insights about what's happening in the industry and getting it from a clinician's perspective. This is the man I turn to. And I listen to his podcasts, I've read his books, I follow him on the postings on social media. He is an amazing thought leader, and he has just released a brand new book we'll talk about today. And so today's topic is really around the current and future impact of generative AI on the healthcare delivery system. And again, no better person to offer a perspective on this than none other than Dr. Robert Pearl. Who is Dr. Robert Pearl? Well, again, a rock star in this industry, but I'll just share a little bit about his background. He is a healthcare leader, an educator, an author, a columnist, and a podcaster. And for 18 years, he served as the leader of the largest medical group, Permanente, where he was responsible for the care of more than 5 million patients on the East and West Coast. He currently teaches at both Stanford School of Medicine and Stanford Graduate School of Business. And he is also the author of 2 books, Mistreated, a Washington Post bestseller, and Uncaring, a Crocus Star recipient. He's been featured on Forbes as a healthcare contributor since 2013, and he's also one of LinkedIn's top voices in healthcare, and he hosts 2 very popular podcasts. Dr. Pearl has been a leading voice on medical and information technology, and his insightful ideas on generative AI have been featured in publications such as the Associated Press, USA Today, MSN, Fox Business, Axios, Forbes, and many more. He most recently launched a book, his latest book, called GPT-MD, How AI-Empowered Patients and Doctors Can Take Back Control of American Medicine. Without further ado, let me introduce you to my hero in this space and an amazing thought leader around the future of technology and its impact on the delivery of care, Dr. Robert Pearl. Welcome, Dr. Pearl.
Thank you, Chris, for that over-the-top introduction.
All true.
Appreciate it greatly, and I look forward to discussing with you, an IT expert, ChatMD, and as you say, how AI-empowered patients can take back control of American medicine, what the future might hold. The book will be published on Tuesday, April the 9th. All profits will go to Doctors Without Borders, a wonderful charity. And anyone who buys the book on April the 9th, that is coming Tuesday, I will make an additional donation on behalf of Doctors Without Borders. To me, transforming American healthcare, improving the health of our nation is vital, and the way that technology can contribute to it is the future of American healthcare, something that many do not see today, but will become standard practice in the future.
Wonderful. In preparation for this interview, I was doing some research on the book, and you were gracious enough to share a pre-release copy for me to take a look at as well, too. And you state that on your website, doctors and patients have lost control of American medicine. A Gen AI can put the power back in their hands. You actually, interesting enough, and I want to hear more about this, you state that you co-authored this book with ChatGPT as well, too. So I want to hear more about this unique collaboration between you and artificial intelligence in developing this perspective and how AI and these emerging technologies will help us reclaim control healthcare and the prevailing corporate interests, as you explained. I want to jump right into the conversation because I don't want people to listen to me. I want them to listen to you. And first question I've got is, why did you feel the need to actually write this book at this particular time in the early evolution of Gen AI and its impact on healthcare?
As I teach at both the Stanford Medical and the Stanford Graduate School of Business. And I, in many ways, see myself as an educator, where I was a clinician practicing full time. I saw that as a major part of the job, educating patients. Certainly, as I became a healthcare leader, became the CEO in Kaiser Permanente, educating clinicians and support staff. So education to me has really been a vital tool for evolution. And I saw last fall that generative AI, and I use ChatGPT because it goes well with ChatGPT MD, but it's really all the generative AI tools that exist out there, whether by OpenAI, whether by Microsoft, whether by Google. A lot of different people are bringing these tools for patient use into healthcare today. I saw that this was the future of medicine. Not what exists at the time, not even what exists today, although today is much better than what existed 6 months ago when I started this project.
Sure.
But what will happen in a few years? Generative AI is improving at an exponential rate, because it's doubling every year. And the human mind can't comprehend that speed of improvement. And yet that means that by 5 years from now, it'll be 30 times more powerful. And a decade from now, 1,000 times more powerful. If I told you your car could go 30 times faster in 5 years, you'd laugh at me or assume that I had no knowledge. But generative AI, not only is it happening, I think it's happening faster.
Exactly.
I look back then, you may have seen that NVIDIA announced an AI nurse chat box this week. It was doing things that I thought would take 2 years to start to happen. So I thought that speed was crucial, and that if I took the usual 2 years, as I did with the previous 2 books, between writing it, and editing it, and the typesetting and the printing and the distribution,
sure,
it came out, it would be completely out of date. That would be a foolish way to go. So I'm looking at a new world of healthcare, but also a new world of communication, where speed becomes crucial.
I love it.
I didn't know how to do that unless I had a partner.
Exactly.
I found a couple of other human beings to write it with me, but it was a lot easier to try to use generative AI. And I thought it would actually be interesting, given the topic and the approach that we were talking about. How can generative AI not erode the good things of today, but augment them and eliminate some of the challenges? And I know there's a lot of fear about writing, using, and I didn't write the book. I started by putting in 1.2 million words that I had published so I could learn my voice. And it became a partner, going back and forth with prompts thousands of times to be able to come up with better words. I didn't need, by the way, one chapter that ChatGPT wrote alone, just so readers could see what it might look like.
I'm interested. Then you highlight that in the book and you say, this is...
I do.
Oh, wonderful.
Everything that ChatGPT wrote, I very explicitly point out.
Sure.
No, that's the only honest way to do it. Everything else I wrote, but ChatGPT facilitated the process for me, sped it along, and maybe most importantly, between the completion of the book and its publication on Amazon on Tuesday, April the 9th, that process was shrunk for what normally would be 6 to 8 months, all the way down to under a month, which of course created lots of different deadlines, lots of different problems. But that's just the world that's about to come upon it. So that's why I did it in that particular way. It also exposed to me some of the problems. And one of the big ones is hallucination. I mean, I have a complete story about the North Pole. And that's why I tell people today that this is not yet ready for prime time.
Exactly.
Consult it, use it, learn from it, but then talk to a human. Don't believe that because of today's shortcomings, that 3 to 5 years from now, it's not going to be able to solve those problems. I am increasingly optimistic with the introduction of plugins, so-called GPTs, recently described memory, and by this release by NVIDIA, that the horizon has shrunk. I worried when I wrote the book I was being too optimistic, and now I fear that I may have been a bit too conservative.
Oh, interesting. First of all, to stop you there and say thank you so much for writing the book. I'm excited about delving into it in greater detail as well, too. And I'm glad you shared the fact that you co-authored it as well, too. And there's a couple of reasons why. One, I'm writing a book right now, and quite honestly, I'm using ChatGPT to help me do some research and help me frame up messaging a little bit better, the writing of it. So I appreciate you sharing that. That gives me even more confidence to continue to leverage it as a editor, as it provided a different way of saying something in some cases and helping with some research that I do validate as well, too. And then I'm also an inspiring artist as well, too. I paint, I draw, and I do some other things. But now I'm starting to overlay my work with generative AI and allowing it to also take the work that I've already created or laid the foundation for and add to it. So it makes the colors a little more vibrant, maybe adds a little different flavor to it, a different perspective to my work. And I'm citing that this is a collaborative effort, too, between myself and what I call intelligent design. And so thank you for doing that. You talk about in your book, the unfulfilled promises of healthcare. I wonder if you could elaborate a little bit more on what do you mean by the promises that have been unfulfilled?
I use that in two different ways. The first is looking at all the challenges of American healthcare today. We've talked about value-based care. We've talked about transformation for almost 100 years. 1930, I think it was 32, the CCMC, the Committee on the Cost of Medical Care, looked at the American healthcare system and it said, it doesn't make any sense. It's fragmented. It needs to be integrated. You need doctors working more in collaboration, coordination, and it's paid on a piecemeal basis. We call it fee-for-service. The more you do, the more you get paid. You make a mistake, right. You get paid twice. Once to make the mistake, once to correct it. It's a crazy system.
It really is.
You look at the data. We spend $13,500 per American on healthcare today. Switzerland's around $10,000. Germany, $8,000. Everyone else spends half of what we spend. And yet we lag the other 12 most industrialized nations by as much as 5 to 6 years in longevity and maternal mortality, particularly for Black women, and childhood mortality. We can go down the list of areas where we actually fail. There are 400,000 people who die annually from medical misdiagnoses. Another 400,000 in addition to them who have major long-term disability as a consequence.
Right.
Quarter of a million people dying from medical error. Diabetes, something that is affecting or will affect a third of the population. Exactly. We control that less than half of the time.
Right. Diabetes we give ourselves, right?
Yeah. We just got on the list of things in the system today. Half of Americans say they can't afford to get sick because although they have insurance, they can't afford the out-of-pocket cost that it would be if it was a significant illness. So the first thing I would say is that we know how to do it better. We know, as you say, ways to prevent chronic disease. 60% of Americans have chronic disease. We could prevent it, but we just don't. So as a clinician, I say, okay, what's the diagnosis? Doctors are working really hard. It's not that they're not working hard. They're very dedicated. They're committed. Patients don't want to be sick. We haven't had the tools. And now I think generative AI creates that tool for us. So that to me is really what's so exciting right now. The second reference that I make is to the failures of technology. I talk in the book about healthcare 1.0, 2.0, 3.0, 4.0. By that, I simply mean a technological notion of healthcare. If you look at the end of the 20th century, healthcare 1.0, we made massive advances. CT, MRI, ultrasound, these diagnostic tools, the heart-lung machine to facilitate heart surgery, a variety of tools to be able to cure cancer, to be able to take what otherwise would have been a death sentence and offer a lot of opportunity and hope and success for patients today. We could have the whole list. 1.0 was a very positive time. Technology came to the rescue. Go to 2.0. This is the electronic health record. It should have done tremendous things. It should have provided information everywhere. It should have allowed us to better manage and avoid chronic disease, but it didn't because we applied it as an economic tool, as a financial tool for claims and billing. You go to a decade later, we now have the ability with email, with secure messaging, with telemedicine. We should have been able to make care far more convenient and less expensive to patients. And we didn't do that. And these are the failures. And I think that's an important lesson when we look at what is now Healthcare 4.0, which is the world of generative AI. Why did 2 and 3 fail? Because any technology that either slows physicians down, which is the EHR, or undermines their economic income, which is the telemedicine and other tools,
right?
It's going to be used and embraced. And it's not because doctors are any way bad people. They're very dedicated and committed. The truth is they don't have enough time and they need to preserve their income like everyone else. And that's why I'm so excited about generative AI, assuming that we are also able to evolve the system of medicine and move from a fee-for-service reimbursement that values volume to one that is valuing outcomes, improved health. I like to think of it as capitation, a single payment to take care of a population of patients.
Right.
And now we have both the incentive and the tool to be able to eliminate and avoid chronic disease, to prevent cancer, to be able to diagnose sooner, to treat more earlier before the complications, the heart attacks, the strokes, the other problems come into play. And so we combine technology, visionary leadership, and motivation. We have the possibility for the first time really in history of being able to improve the not just the lives, but the health of people, to be able to lower the cost. I think of it as a combination. It's lowering cost, not by cutting back and skipping, which is what we currently do often, but by raising quality and improving access. And we can do it using technology. So I think the future of medicine is very bright, and not very many people have even focused on that. There's a lot of information. As an IT expert, you're well aware of this, about how generative AI is going to improve productivity in business, going to be able to change aspects such as in the writing process that we talked about earlier. But now I think that healthcare will be the biggest success, because I think it could catapult American medicine forward, not by a few months, but by years and maybe even a decade.
Sure. Let me stop you there, because I'm really curious to get your perspective. You talked about kind of those generations, 1.0 to 4.0, and you actually, that was my follow-up question, so you went right into it. So thanks for sharing that. And I think the biggest challenge is not necessarily the technology advancing, but the human equation of it. You look at interoperability, for example. Every other industry has figured out how to share data fairly seamlessly, right? Without a lot of challenges, and have embraced it. But yet in healthcare, we still seem to struggle with it, and we still seem to, quite honestly, make excuses about it. How do you see the human factor impacting this adoption? You hear all the time that I can't trust this AI. You got the hallucinations that take place. I don't think it's ever going to replace the human doctor or a human healthcare professional. But the reality is humans have error rates too, right? We misdiagnose patients all the time. We give them the wrong drugs. We diagnose the wrong diseases all the time, but yet no one's saying replace that person. So I'm just curious, from your perspective, do you see AI in any way replacing any aspect of the delivery of care that humans normally do on a day-to-day basis? And then just comment on the human factor of the adoption of it.
You're absolutely right that what exists today should not be the replacement for what clinicians do. The technology is not there. But given a couple of years, and I want people getting ready for the future. See, that's the problem with people. We often look in the rearview mirror. We're looking at this today, and instead we should be looking at what I think of as the first derivative, what's about to happen into the future, and be ready for it when it comes rather than surprised by it.
Or suppressing it in some cases, or suppressing it. Instead of fostering it and cultivating it, many suppress it.
When I do that, I see this tremendous potential for the technology to be able to do, and I estimate maybe 20% of what clinicians do today by patients. Let's say it's the middle of the night. Let's say it's 11 o'clock at night and you have a child and it wakes up with a fever, 102.5. What should you do? Do you take the patient to the ER, or you like you to wait a few hours, be exposed to people coughing with a communicable disease? Or do you wait till the morning and then find out you made a big mistake? By the time the pediatrician's office is opened, some major complication has happened. So you got to guess. You want to go to Google and click links, you're not going to find any information that's usable. You need advice. So we often just default to the ER. It'd be a lot better to have expertise around that. And that's what a generative AI does. It's able to empower the patient, to empower the parent, to put enough information in place to get an answer. Will it always be accurate? No. But will it be far better than what happens today? Absolutely. Today we just, yes. And now we actually will have expertise available. We'll take chronic disease. We said earlier, 60% of Americans have it. How do we manage it? Come to my office every 3 to 4 months. In between, I have no idea what's going on.
Right.
I don't want you to bring to me all your blood glucose measurements. I can't handle all of that.
All that data. Exactly.
Easy. It's minuscule. Or even think how much is missing. Genetic information, the DNA. We know it's so important. Why is it not part of clinical medicine? Because it's too big. No human brain can handle the magnitude of information in a human genome. For ChatGPT, not a big problem. You can see the doctor. Why not understand your problem before you go so you can ask the right questions? What do we know? We know that a large percentage of Americans, when they leave the doctor's office, they're not really sure what the doctor said because they didn't go in there with enough knowledge and expertise. Sure. That's the advance that is there. Yeah. Now, I think you're absolutely right that if all we did was put this technology and replace some of the doctor's actions, that there'd be a lot of resistance to it. And that's where I think this collaboration between doctor-patient and technology needs to happen. I think it's going to augment the doctor-patient relationship because as we evolve to a capitated form of reimbursement, now maximizing health becomes the highest priority, both doctors and patients, avoiding chronic disease, preventing medical errors. These are the things that now get rewarded in that type of system. Why didn't we do it before now? We didn't have the tool.
Sure.
Now we have the tool. So I think, yes, I think a lot of problems that maybe you would have gone to the doctor in the past before, you'll now take care of yourself. Your chronic diseases will be managed completely different. You'll be having wearable devices, loading information. You'll be able to be followed every day, given guidance and direction. And I think that even the hospital at home is a great example of that.
Right.
We know that 20, 30% of people in hospitals today would be better off at home, surrounded by loved ones, not being woken up across the entire night, not risking delirium and medical errors. But we can't monitor them.
That's right. And I think to your point, too, I was going to point this out, but you also pointed it out as well. When you think about the emergence of wearable devices that can provide 24/7, 365 monitoring my vitals, my condition. And so if there is some sort of anomaly that's happening, we could be more proactive and respond to it before it becomes more acute. Oh, I see that your child's temperature is starting to rise. Why wait until the child says they're sick? I don't feel so good, mommy. Versus the technology responding saying, I'm seeing a spike in your child's temperature. You may want to do X, Y, or Z. And hopefully then avoiding some more acute care issue from occurring with that individual. I love the idea of leveraging these technologies, not only AI, but the wearable technologies, the virtual care technologies, patient-centered medical, et cetera, to, again, help us recover faster, be more proactive in our care, and then support the clinician in their effort to be a better provider of care to that patient when it's required to get their advice and direction as well.
And no one should think about generative AI as a one-directional tool. Essentially, it will be a dialogue. Same way doctors are trained in medical school around algorithms and around differential diagnoses. It will ask the questions, and not today, but it'll ask the questions. It will be able to know, using plugins, GPTs, what the clinician expected the course of your chronic disease would be after the start of a medication, and whether it was working aligned with what the clinician predicted. And rather than waiting 4 months to have the medication adjusted, it can do it after 1 month. And yet at the same time, just because a one reading is abnormal doesn't mean you need to have a change. This is the kind of expertise. And I want to keep saying that. We have only knowledge.
You're right.
Yeah. Expertise was taught to doctors by a decade of hands-on experience. We now have a tool. It can't replace the doctor. It shouldn't replace the doctor. It should do the things that can be done safely without a clinician, freeing the doctor up to now be able to spend the time with the patient. The average visit is 17 minutes. That's not enough time to delve into the specifics of who you are and how you want your care and what you're afraid of. And that is just as important to medicine as a blood pressure taking or a pulse reading. Now we have that more time by being able to figure out which patients can be taken care of safely at home, reliably at home, which ones need this added attention. What we have today in many ways is the worst of both systems.
Hey, you talk in your book about the ethical issues that we have to tackle as a society when it comes to starting to embrace the use of these technologies and the impact that they may have on the quality of care. Elaborate a little bit more on what are some of those ethical issues we have to deal with.
So you're right. There are 5 parts to the book, one of which, by the way, is on leadership, and one of which is on the challenges, privacy, security, bias, misinformation. And I'd like to offer 2 thoughts to viewers and listeners. The first thought is, don't compare the outcomes against some notion of perfection. It doesn't exist.
Right.
Ask yourself, is this going to be better than what exists today? Can we do better than 400,000 misdiagnoses? Maybe 50,000. That's 1/8 of what currently exists. Medical errors. Maybe there'll be 10,000 medical errors. But how about the fact that 250,000 people die annually from medical mistakes?
Right.
Let's use that as the realistic place to go. And that's where I think that there's a tremendous opportunity to be able to improve upon where we are right now.
Yeah, and I'm glad you pointed that out, because I think sometimes we want to think that technology will equate to perfection, that if we're expecting the technology to be flawless, that it will never, misdiagnose or, provide solution based on the content of the information that has available to it. And so like a human being, right, where we make our decisions based on the information that we have available to us, the things that we learned growing up, the information we digest, and then the things we see and observe as well. Sometimes our perception can be wrong in some cases, and we make errors. And so we should, to your point, not expect the technology to be 100% accurate all the time. But is it helping to reduce the level of errors and issues that exist in the delivery of care today? And ultimately, I think did we leave things better than when we started is really the measure we should hold ourselves and the technology accountable to.
Let me add one thing.
Sure,
In addition, we should stop talking about AI as though it's a single entity. Talking in the book about 3 different kinds of rules-based, it's called a narrow and now generative AI. And much of the problems, particularly in areas like bias, came out of the narrow AI. It's like 10,000 mammograms, half of which show cancer and half of which don't. I use neural networks and other analytic tools to be able to compare the 2 groups. The technology is going to find a significant number, maybe 50 or 100 different slight biases that you and I can't perceive. And
Sure.
It can do better than biologists at being able to take these tests and be able to define when there's a malignancy and when there is not. But when you go from visuals like mammograms to being able to look at other data sources, ones dependent upon humans, the biases of human practice show up in narrow AI applications. Optum is an example, wanted to provide additional services to individuals who are at the greatest risk of having a major medical complication. So they entered their data into the database to select the individuals who should receive this added funding. And lo and behold, rather than about half of the people being African Americans, it was closer to 12 or 15%.
Sure.
And the headlines screamed that AI was biased and discriminating. No, it was just replicating what happened in clinical practice, where doctors provide, and we saw it during COVID, less care to their Black patients than they provide to their white patients. And that data is just replicated. Generative AI won't be perfect because it will have some of the information come out of the same sources, but it'll be able to balance it. Instead of having a single set of data, it'll have a broad set of data. It will have information on bias in analysis and bias in healthcare. It will be able to put in place the criticisms. And why did the narrow AI make the mistake? Because it used the dollars that we spend. And in truth, when you start to take 2 patients, I wonder if it was a Black patient, one's a white patient. The Black patient in the United States gets $1,800 a year, less medical care for the same degree of risk and severity. So the machine assumed those individuals are going to be healthier. I will be able to see that bias. They'll be able to say, Dr. Pearl, the last time you saw a patient like this, you ordered a COVID test. Why aren't you doing it in this patient? And I'll be able to bring to consciousness implicit bias Again, it won't solve the problems. It won't make everything be perfect, but I think it will be so much better than what exists currently.
And I like the narrative you presented on that as well, too, because as you were talking, I was thinking AI is a learning platform. It's going to take the content it has available to it and make its own inferences and decisions behind it. If that content is inherently already biased, then it will lean towards more biased outcomes. But to your point also, we have to make sure that there's a certain amount of governance that's built into it, that AI is also asking those questions back to the clinician and saying, oh, I see you're treating this person differently than the last person. Help me understand the rationale behind it so that I can process that information, or by the way, hold you accountable for that decision as well. So I love that concept and that approach to, again, holding us as individuals accountable through the use of these technologies as well. I know we're coming close to the end, of the segment, and I would love to have you back on. And there's so much more I want to talk about AI and just emerging technologies in general. And as I mentioned to you before, you always have an open invitation to come back. So feel free to, if you want to talk more about this, we can definitely do that. But you mentioned in one of the final chapters of your book, you talk about why technology alone is not the silver bullet. Why isn't it alone going to solve the problems facing healthcare? Elaborate a little bit more on that.
Leadership will be equally important because technology alone isn't going to change the way that humans, clinicians, practice medicine. And again, part of my evolution as a healthcare observer and leader is that for at least a decade, I've written about and read other people who write about all the reasons why medicine needs to change and improve. The kind of shortcomings, the misdiagnoses, the medical errors, the failures to control disease. This is not new information. I didn't find it alone. A lot of people have commented upon it. The Commonwealth Fund for now 2 decades has reported excess costs and low quality outcomes of American medicine. So why has change happened? And again, I go to the 2 points. One is we haven't had the technology. We have the technology too now. But more than that, people are afraid of change. The psychological literature indicates that our fear of loss is far greater than an equivalent amount of positivity towards gain. I offer you the chance to say, let's flip a coin. And if you get it right, I'll give you $3. And if you get it wrong, you got to give me $2. Most people won't take those odds, even though statistically they're a lot better than going to Vegas. That's the challenge that exists right now. Help people overcome, I'll say, that fear. And it's not a rational fear. It's not just a Luddite fear of technology. Just worrying, I'm barely getting by now. If I have any less money, I'm going to be in trouble. I can't feed my family. And that threat is so great. They're going to have fears that says, as you say, a misdiagnosis. They're going to miss the fact that they're likely to have fewer misdiagnoses. There's a lot of different fears, and until they can get past that, for clinicians, they're going to worry about medical errors. They're going to worry about their income. They're going to worry about the clinical outcomes and getting sued. There's a whole lot of fears out there. As humans, that is a primal component of our brain. And helping people get by it. In the last part, I talk about leadership. I present the A to G model of an aspirational vision and specific behaviors, the context, the data, the engagement of the leaders, the broader faculty that's needed, and the governance structures that need to be changed. And making all those things happen isn't going to be easy. As clinicians, what do they say? It's like herding squirrels, getting doctors to make the changes. It's just not in our training to be a collaborative coordinator. And that worked okay in the past. When what patients got was acute disease. You got pneumonia, you broke a bone, you had appendicitis. It doesn't work for chronic disease. And it certainly doesn't work for patients with multiple chronic diseases. But helping people to get past that and to come together and to accept some risk and to give up a little bit of autonomy for the greater good of patients, that requires leadership. It doesn't sound like it should, but it's a massive shift from where the current healthcare medical culture is. And so that's why I think there's a vital role for leadership. If not, it's not that that generative AI won't make some additions and improvements, but the fundamental
Possibility of it, though.
failures will not have been addressed. And as you say, the possibilities will not have been realized. I think that we are at an amazing time. I think of it very much like the introduction of the iPhone. If you go back to 2007, people saw the iPhone basically as something they could use when they're traveling to make phone calls. They kept it in their trunk in case they had a flat tire and needed to get help. They in no way could see the ways that it would change.
Oh my God, yes.
Everything from retail to finance to information to social to all the pieces. We're at that same place right now. I write in the book about a surgeon. She was in the operating room. She did a surgery. It went really well. And yet the patient wasn't responding following the completion. Something was wrong. Wasn't clear what it was. The standard practice would have put the patient in the ICU, might have led to a tracheostomy, may have led to other problems that would be irreversible. Used the application, the GPT-4, found a exact similar case study where the anesthetic that had been injected had diffused far more rapidly in some individuals than in others. And you could feel and realize that 30 minutes from now, things would be good. And in that way, a disaster was prevented.
Oh, wow.
I think that generative AI will be just as important to clinicians and to patients in healthcare as the stethoscope was in the past.
That's powerful. When you talked about the technology evolution from 1.0 to 4.0, I think we have to also think about that in terms of the clinician, the 1.0 clinician now to the 4.0 clinicians. 5 years, 6 years from now, clinicians will operate and deliver healthcare much more differently through the use of technology like AI than they are today. And that doesn't mean you still don't have value in this process. It just means that the way you deliver care today is going to be very different than the way you deliver care a decade ago. And I look at the example, I'm a science fiction buff, and I look at the example of Star Trek, for example, and them using those devices 50 years ago, arguably 40, 50 years ago when the first Star Treks came out. We were looking at them using scanning devices, the tricorder, and the little device that the doctor used to look at, that to scan you to get your symptoms, and how the devices were monitoring your health when you were laying in the bed. And back then, we thought that was science fiction. Now, today, we're actually making that a reality. And then the way that clinician, that doctor, Dr. McCoy, treated that patient was very different than the way patients were being treated in healthcare back then. And I think that's the potential and the opportunity that clinicians can embrace. And that is, we can still provide the mission of care. We're just going to do it differently. We're going to start to leverage these tools to be resources for us to be better, smarter clinicians, and we're going to be able to hopefully address issues before they become much more acute in a patient earlier in the process than we have in the past. And so I
think you have to, as you say, look at what's going. You have to look at what's going on right now. 60% of the doctors are burned out. The greater percentage of nurses are thinking about leaving the field of medicine. 70% of patients say that the health system needs radical change. How's it going to happen? If we keep doing what we're doing right now and expect a different result, it's not going to occur. We now have a tool that can empower patients, educate them, give them expertise, a tool that doctors and patients can use to fortify the doctor-patient relationship. I think it can be problematically put in place just like everyone else the record was, but I'm hopeful that both clinicians and patients will see the possibility. I want to encourage viewers and listeners, this is the time to start practicing, to start using it, just to see how it would work. Don't rely on it for the final answer.
Sure.
Just learn from it. It's been estimated that it takes about 10 hours for an individual to become knowledgeable about how to enter the right prompts about all the things that it can do. Then check it out with a human. But if you're a doctor, start using it. When you're stumped, start using it to figure out a better treatment. Start using it, just pretend you're your patient. Put all the information in place, all the information, and then see if it comes up with a different answer than the one you gave. Follow it along. And if you're a patient, learn how to do the prompts, how to put your information into place, how to ask the right questions. If you just say, tell me about a disease, you'll get the generic answer. Tell me about me and the disease. Pretend you are a specialist in this particular area. Provide me with as much information as you can. You're going to be surprised at how good it is and how accurate it is.
Wonderful. I think we'll leave it on that note. Again, thank you so much, Dr. Robert Pearl, for your wisdom and insight and encouragement about the bright future that technologies like generative AI, ChatGPT, will have on the delivery of care. And for those who, when this airs, the book will be out by then. So I want you to share with our audience where can they find the book and any information if they will have questions for you about the topic and any of your additional work that you've done as well too. Where can they find it?
The book is available on Amazon. As you said, it became available on April the 9th, and people could order it directly from there, all profits to Doctors Without Borders. If they want to have more information on generative AI, medicine in general, they can go to my website, robertpearlmd.com. There's a vast amount of information. They can sign up for my monthly musings that are now accessed by over 50,000 people every month, with links to a variety of external sources, including podcasts like this one. And the most important thing they can do is to tell friends and family, colleagues about the opportunities that exist. The data says that to create transformation requires about 25% of a population to participate. And the broader the audience, the more diverse it is, the better the answers that are given. The more people who can come on, join in the process of change, the better it will be, the faster it will occur. Together, we can make American medicine, once again, the best in the world.
Wonderful. Thank you so much again, Dr. Robert Pearl, one of the leading voices of medical and information technology and the author of ChatGPT, MD, How AI Empowered Patients and Doctors Can Take Back Control of American Medicine. Thank you so much for being on the program. And thank you, everyone, for taking time out your busy schedules to listen in. Please, as always, your feedback and comments are welcomed. And thanks for your support and look forward to seeing you on our next program. Take care and God bless.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.